Pregnancy, I always say, is not a disease. It's part of our daily living, and every pregnancy is unique. But then, it may come with a complication that can take the life of the mother or the baby. The good news is that we have the opportunity to educate ourselves, to go through the pregnancy safely, deliver with less or no complications and interventions. Welcome to the Pregnant Show with me, Euphemia Koliki. And today is International Midwives Day. And I'm joined here in the studio with Miss Martha Soti, who is joining me to join our colleagues out there to celebrate the day. Miss Martha.
Yes, sister.
You are welcome to the show.
Thank you very much.
Today is International Midwives Day.
Yeah.
How do you feel?
So good.
You're really happy.
Yes,
I can
I'm
really
happy
see
that we are celebrating our day today.
That is right.
Yeah.
All right. But before we start the discussion, let's go for a quick commercial break and we will be right back. Welcome back from that quick break. Like I said, today is International Midwives Day. And I welcome you once again to the Pregnant Show with me, Euphemia Koliki. And today in the studio here with me is Miss Martha Soti, our classic midwife, our best midwife of the year. You are welcome.
Thank you, sister.
You've already expressed your excitement about the day.
Yes, please.
But what are some of the packages for the day?
For the day, a lot. So I will trust the viewers to get the best out of us. So
and I think our midwives are doing good jobs out there.
A lot.
Especially those in the rural areas.
Very, very, very.
All right. So you are welcome to the show once again.
Thank you very much.
So today is Midwives Day.
Yeah.
So we are doing everything midwifery, everything about the midwife.
No problem.
So before we start, who is a midwife?
Okay, I would say a midwife is a professional who has been trained and licensed to take care of pregnant women and their newborns through childbirth and then after childbirth. And then also the midwife also does some family planning services and counseling. Yeah.
Okay. Are your duties as a midwife, because we always see midwives in the hospital, are your duties as a midwife limited to only the hospital?
No, please.
How far does it go?
Oh, it goes as far to the communities and also especially those working in the rural areas, to even family members as well.
So take us through some of your duties as a midwife.
Okay. Some of our duties as midwives is we take care of pregnant women.
Okay.
And their newborn babies especially.
Up to, is it throughout, maybe after delivery till the child grows, or up to what time?
No, up to 6 weeks.
Okay.
Our duty is to take care of the pregnant women and then assist them during delivery and then after delivery up to 6 weeks. And then we hand them over to the public health nurses to continue with their immunization schedules. Okay. But then if they still have any problem, they can still come to us.
Okay. So everything pregnant women, you take them through pregnancy, during labor, you are with them. Yes. And then you help them deliver their babies. Yes. Then after delivery, you are also with them.
We are also with them
through the postnatal period, so 6 weeks.
Yes, please.
Then you hand them over.
Yes, please.
What is your relationship with, as a midwife, with pregnant women and their relatives? Because you are nursing the pregnant woman who is coming in with either a husband, a sister, or mother, or something. Okay. What is your relationship with the third party that comes in with the pregnant woman?
Okay. The relationship with the third party that comes in is very cordial, because I see that they play the major role. As at that time, the woman is not of herself. Yeah. So they play the major role in place of the woman. Okay. So we establish very good rapport with them, and then also we also encourage them as they bring the woman to the hospital, because they are the first point of contact if they should call for any information about the woman.
Okay.
So we establish very good relationship with them.
This question is very dicey, but let me ask you.
Okay.
A pregnant woman who is mentally challenged, whose duty is it? Is it the midwife, or somebody else?
As in the pregnant woman who is
mentally challenged, maybe somebody who is having a mental problem.
Yeah.
You still manage such people?
We do.
As a midwife?
Yes, please.
Wow. So they beat you along the line?
You have to, because you know the person is mentally sound. So therefore, you have to use some therapeutic way of communication to be able to calm the client down.
Okay.
So we also have our skills of managing them.
Tell us a few skills you exhibit on the ward.
On the ward. Okay. We assure that our infection prevention is very correct.
Okay.
And then we talk therapeutically to the mothers to prevent them from anxiety and their relatives as well.
With the infection prevention, let me ask, which areas do you tackle the most?
Especially during delivery.
Sure.
When the baby is coming out, you know, the baby is passing through the perineum, so we have to make sure that everything there is very clean before the baby passes out, so the baby doesn't come out with any infection.
Okay.
Yeah, and then with our instruments, we are very careful about that.
Then we go from this angle, we'll move on to women who have their deliveries with not in the hospital but with TBAs.
Okay.
Let me say TBAs, we all know are traditional birth attendants.
Yeah.
Okay. So the women who go to the TBAs for delivery, are the TBAs well endowed with this infection prevention knowledge, how to care for the pregnant woman, just as you, the midwife, you do? Do they have that adequate knowledge to be able to care for the pregnant woman like that?
The TPAs don't have that adequate knowledge. You see, they are not, I explained by saying the midwife is someone he's a professional, who has been trained in Lancers.
Okay.
But they has not been trained in Lancers. And for that matter, they use the home therapy. And so they end up with a lot of complications. So they, with the infection prevention, they lack infection prevention. So therefore, they end up with a lot of complication. And then also the TBAs, as I would say, they are very secretive. They don't come out to tell you they are TBAs. Because most of the time, their client's relative are the TBAs.
Okay.
Yes. So they hide their identity.
But why do they do that?
They, you know, some people, and you know, some TBAs, they were trained by doctors some time ago. They used to go for training. But some do not go at all. So they are doing their own thing. So they are scared you might ask them certain questions they will not be able to answer.
There was a time we went through the rural areas, like let's say Sege, Pampram, Ningo, thereabout. And we realized that some TBAs have licenses. They even put it in a glass and they placed it in their wherever they do they offer their services. Let me see. Some even at prayer camps. Then they put their so-called licenses over there. And now our pregnant women tend to go there the more. How genuine is that license that they are having? Okay.
I would say the license is not genuine. Because as you said earlier on, with the TBAs, now they take the license from pastors. So most of our TBAs now are now prophetess. And that is what is pulling the women pulling them to go for services. Because, you know, we Africans, we are very religious. So we want to hear things about
the prophecy
about the pregnancy. Some women tell them the child in the newborn inside there has been locked. So they have to open with the key. Some they sell anointing oil. You know, we want to hear this as women in the society. So they used to go there because of the hearsay.
So in that area, how much influence are we as midwives having on our clients which will prevent them from going to the TBAs?
So I would say that what we have to do is to educate them more about the risks of going to the TBA, because it will be very sad for a pregnant woman to carry a pregnancy from 0 months to 9 months and then losing up your baby at a prayer camp in the name of they are unlocking your child, which if you are in the hospital, something good can be done about it.
And here lies the case. The same people we are trying to avoid them going to, this our own people comes to us having some kind of impressions about the midwives. There are a lot of public opinions about we midwives.
Exactly.
Okay. So if we are trying our best that they shouldn't go to those people, they come to us, and with those opinions, they come and meet one or two things. They feel that whatever they've heard or whatever they've been told is true. And that is why they've come to meet whatever they've come to meet. Is that not rather pushing them to go to the TBAs?
Okay, some of the public opinions about midwives is that they see our profession to be like it's for old people.
Mm-hmm.
So sometimes when they come to the hospital and they see with the young ones, they begin to lose competence in us.
I guess that is a big challenge to the young midwives.
Exactly. Thinking it's for old people, so we can handle them better. But trust me, we the young ones are rather
we are doing
skillful.
the best.
Yes, because we are learning a lot, and then we are upgrading the midwifery system, and we are becoming millennium midwives.
Thank you.
So the public should rather have interest in us, that we can do better. The old women are tired; they are even tired. So we are the smart ones now. Yeah, and then also they also think that midwives are wicked.
Why is that an opinion? Like thinking that midwives are wicked? Because we rather help you bring your baby to the world.
Yes. Sometimes when you are in a procedure, in a serious procedure, and the client is asking you a question, and you are focusing on the client's relative is asking you a question, and you are focusing on the client, at that point in time, you become wicked to the relative.
They claim we beat them.
They claim
the midwives beat
them. Then it will be some midwives. Because I don't think a midwife will beat somebody in pain. A client or a mother who is already in pain, and then they will beat them. I don't know.
I've never seen that before.
Myself, I've never seen or heard.
Experienced that before, but it's one of the public opinions I've heard out there. But I know midwifery as it is, and then the kind of job that we do, we are exposed to a lot of things that people will say about us.
Exactly.
You understand? For instance, attending to a patient whose relative is asking a question, you are not giving attention to such person, you tend to be a bad person.
Yes,
and there was an experience that I had. A lady came to the hospital in the name of she's bleeding. Let me just share this with our viewers as well as our colleagues out there. Okay. She came to the hospital. She said she was coming for antenatal, and then she went to the antenatal clinic, but they've closed. They've closed, and she went to the lab. The lab sent her back to go to the antenatal clinic. They will give her some lab requests. Fortunately for her, when she got there, she met a midwife there who gave her the lab request to go to the lab. Mm-hmm. She came back from the lab and the midwife was gone. So she came to the ward. On coming to the ward, she came to meet us. So that's, she's gone to ANC, they've closed. She's come to so my senior was like, okay, ANC, they take you through process. So in the ward, we can't take you through that process. What we can do is that analyze your problem. If it needs a doctor, we will call a doctor for you. Then she just came out, yes, I have a problem. Okay, what is your problem? I'm bleeding. Are you impaired? She said no. Then what shows that you are bleeding? She said she felt that she was bleeding. We said fine. Then you will get a pad, put it there. We observe you for some time. Then we can tell whether you are bleeding or not. Because we all know that the amount of blood that comes out tells us the severity of the bleeding.
She might be spotting.
Well, so she said she won't do what we said, and that she wants to see a doctor. Then her next utterance was, she heard that midwives are this, that. So she was not coming to the hospital to seek help, but she was coming that anything a midwife will say, she will meet the midwife with anger because of what she has heard. And I think that is a great challenge to our profession.
Yeah.
That is a very big challenge, because if you don't accept us as your caretakers in society, how then do we offer whatever best is in us? Am I right?
You are right.
So tell us some other challenges that you face, especially in your area where you find yourself.
Some of the challenges I faced is lack of equipment. We lack a lot of equipment to do our work. So we turn up in everything. We used to improvise, especially with the resuscitator. We need a resuscitator. Let's say not even my area, but I think in Ghana as a whole. Because if you give birth to a baby whose breathing is not all that good, and you need to do something, and you don't have the equipment, and then you are improvising things, time is also a factor. So we lack equipment. And then also our referral system is very poor.
Is it within your area?
Within my area. Because my area, for instance, when there's a problem during delivery or antenatal or any problem concerning a pregnant woman or the newborn, and then you have to transport, the number of hours a client will even look for a car, because we don't have ambulance. And then this national ambulance, when you call, sometimes it doesn't even go through. Or sometimes the person will pick and tell you in 30 minutes time. It will end up being 2 hours. And always about time, delay. And then our routes are no good. So where I am, can basically refer our cases to Batokali Hospital, which is about 1 hour 30 minutes. That is if the car is
where you are.
From where I am, I'm working. 1 hour 30 minutes. That is if the car is fast.
Which facility are you?
I'm coming from Lekono Chief Zone.
Right, okay.
So the name will even tell you I'm coming from far.
Okay.
So about 1 hour 30 minutes. So I think the referral system is very poor. Very, very poor.
Before I move on, for how long have you been in service?
About 12 years.
Wow. You've been a midwife for the past 12
No,
years?
I've been a midwife for the past 5 years.
Okay.
Okay. But formerly I was a community health nurse.
Okay.
Yeah.
All right. The way you are able to stress on your challenges, it tells me, But if you as a midwife in the health a chip zone, you are having this challenge, transportation, equipment, what about the TBAs? Have you had time to meet the TBAs?
Yes.
You spoke with them one-on-one?
Yes, I speak to them.
Okay, so they also have some challenges.
They also have some challenges. Because, we have a tool called the pathograph that we use to manage labor. But they don't have any tool. So with our tool that we use to manage labor, if it's exceeding 24 hours, then we should know that, no, there's something wrong. We have to transport the client to a bigger facility to be managed. But with the TBA, they don't have any tool. They just manage till you deliver. So when
whether there's a problem or not, you are just there.
Whether the labor is prolonging or not, they are just there.
Whether baby is not breathing well or not,
nothing.
In distress, they don't even know.
They don't know.
Okay.
Until worst comes to worst, then they will come to you. Already the time has been wasted.
Okay.
They have wasted the time at home before coming to your facility.
All right.
It's now that you also come to prepare to move to the bigger facility.
Okay.
So at the end of the day, it's either we lose the baby or the mother, which is a big problem in the country.
How is maternal and neonatal mortality within your sector?
Within our sector, God be so good, you see, it's low. So far, in my year of practice, I haven't had any maternal mortality or stillbirth.
Congratulations.
Thank you. I haven't experienced one before. Not at all.
This tells us how competent our midwife is, and the best our midwives are doing out there just to keep our pregnant women healthy and then to take them through the pregnancy journey safely without any problem. Today is an International Midwives Day. It is an opportunity for you to say thank you to that midwife that put a smile on your face. Say thank you to that midwife who helped you go through your journey successfully without any problem. Even if there was a problem, she was there to assist you. She was there to intervene. To say thank you to that midwife who has been there for you for all this while during the pregnancy, labor, and delivery, and even after delivery. And even if possible, say sorry to that midwife you think you have offended. You think you are the patient and the midwife is your caretaker. You say that you is the midwife rather that has offended you. But trust me, you will also have offended the midwife in one way or the other. So kindly say sorry to that midwife you think you have offended. So before we draw our curtains down on the discussion, what are your messages for us as midwives? And then give us your celebration message. What do you have to tell us, or how do you want to celebrate the day with us?
Okay, what else I would like to say is that midwifery is very interesting.
Exactly,
And
it's
then,
a very nice profession.
Yeah, and so the public should have competence in us,
Okay.
so that we'll be able to put up or deliver our best.
But how, before you even say your message, how are you managing this your challenge, especially the public not having competence in us as young midwives coming up? How best are we managing this very challenge? Because they need us.
Yes.
Right now, the old ladies are not there.
They are not there.
It is us. And we are doing our best. We are doing all the best that we can. So how can we bring the public in to accepting us or to taking us in so that we can break that challenge that we are having? How best can we do that?
It's all about communication. We have to communicate with them therapeutically so that they have interest and competence in us.
And another thing to depends on us, how we exhibit our services to our clients.
Exactly.
Some hospitals actually endorse on male involvement or partner involvement or relative support during pregnancy, labor, and delivery. And in one or two ways, they may see something you think is professional, but they think what they are saying, because they don't understand the professional work that we do, they read different meaning to it.
Exactly.
So I think, like you said, communication, I also adapt to it that anything that we do, we need to tell our clients, even if you are, it's not the name of communication just in, okay, you are pregnant, I'm here to see you, but let's build relationship
with them.
How far can we build that relationship? Because people go as far as building a relationship with their client that they even become family friends.
Exactly. So we can build relationship with them, not really in the hospital, but after that we can follow up.
Okay.
Yes, and that will bring the cordial relationship between you, the client, and the relative.
That I know we do a lot. I know we do that aspect a lot. Okay, so thank you for coming.
You're welcome.
Now your message for us.
Like I said, my message is that midwifery is very interesting. So the public should have competence in us, and then also we will also how do you call it, back up any message they also give us. We put it into practice.
Okay.
Yeah. So that's the message for the day.
Okay. So that is the message for the day. To all our midwives out there, you are doing a great job. In fact, keep up with the good works that you are doing. It's your day and you have to celebrate. If no one celebrates you, celebrate yourself, my dear. It's your day. So celebrate yourself. I mean, post up the works that you've been doing in the hospital. Be happy, feel free. Enjoy the day with your patients, with your colleagues, and everyone around you, with your family as well. Enjoy the day. And all we are saying is Happy International Midwives Day to all of us.